Good morning, good morning, good morning, and welcome to the Great Lakes South radio program on WUFO 1080 AM and Power 96.5 FM. I'm your host, Francesca Messiah, Kaleida Health, Manager, Workforce Development. Did you know Kaleida Health has over 500 positions on their website when you Google Kaleida Health Careers? And did you also know that our jobs, the entry level, our entry level jobs, some of them you have to have a high school diploma or a GED, but we also have positions all the way up through your master's, your PhD, and everything else in between. Who is Kaleida Health? Well, Kaleida Health, we are the Western New York's largest healthcare system with Buffalo General Medical Center, Oshai Children's Hospital, Gates Vascular Institute, Millard Fillmore Suburban. We also have two long-term care facilities, High Point at the corner of Michigan and High. We also have a long-term care facility at DeGraff, that's in Niagara County. We also have DeGraff Emergency Medical Center, which is on the same campus. Kaleida also has clinics located throughout the city for expecting mothers, for all adults, for women, for children, Niagara Peds to name one, Kensington OBGYN to name another. Also, if you were wondering, does Kaleida Health, are we in the community? Absolutely. We do on the average nearly 100 events a year. So if you are interested in having us for either a job fair, we love job fairs, or for a community outreach, we equally enjoy doing that. And public speaking on health needs for all ages. Please send an email to F Messiah, MESIAH. Again, that's F as in Francesca, Messiah, MESIAH at KaleidaHealth.org. That is KALEIDAHEALTH.org. And I want to say it was wonderful seeing everyone last weekend during the Juneteenth festival. It was a lot of fun. Well, on with our show. Our guest for today, who is with us, her name is Caroline Bukenya. Caroline, good morning, Caroline. How are you?
Good. Good morning, Francesca. Thanks for having me.
Oh, you're welcome. Caroline is relatively new to the Western New York area and new to Kaleida. And Caroline's title is Vice President of Data Strategy and Analytics. And when I met Caroline a few weeks ago at the Corporate Challenge, I said, what is data analytics? And not only did I say that, I said this would be a great show for the Great Lakes Health radio program. So today's topic is data analytics. Caroline, I am so glad you were able to join the program.
Thank you. Me too.
Oh, you're welcome. So so let's just start. So briefly describe what is data analytics, and if you could also give examples, because when I Googled it, it had different types of examples, and also are data analytics new in the area of healthcare?
Okay, so I will start with the first question, and I will just start at the most basic level. So, data analytics is pretty much the science of taking raw data, examining the data, then using that data to identify trends and draw conclusions. So, with data analytics, any single data analytics, the first and best place to start, what we call best practices in the statistical world, is you collect data. So we'll give a good example. We'll start with a classroom. So let's think of a first grade classroom, and they are 20 kids in this first grade classroom, and we want to collect data regarding these 20 kids. So we probably have an Excel spreadsheet for purposes of simplicity that shows the kids'
hold on.
name.
Hold on. What's okay? Everyone may not know what a Excel spreadsheet is. So, like, what's on a Excel spreadsheet? Like, what do you mean?
So when I talk about it's just a file, like it's just it is a Microsoft product, and it's a file that shows people's names. It'll show someone's name, so the kids' names in this example. It will show probably their age, their date of birth, and maybe their favorite food, because these are first graders, and favorite food is really important for first graders. So it is is a document, and you can think of it as a PARD, an electronic document that is just electronified. So it becomes an Excel spreadsheet. So that's what, and you can collect data on a writing pad too, and take this data and put it in a computer in an Excel spreadsheet, which is a Microsoft product. So that's our first step. So we're in a classroom and we collect data. Then after collecting the data, our second step is to clean this data. And this is what is actually the steps that we do around data analytics. So what do we mean by cleaning the data? So maybe when you think of first graders, your average first grader is 6 years old. But maybe, Francesca, when I was collecting the data, I had a typo and maybe put date of birth 2009. Oh my, that's a 14-year-old. That cannot be a first grader. So that's what we call the data cleaning process. So in this case, because it's a class of 20 kids, I can easily go to the school administrator and say, oh, by the way, Joe's date of birth is incorrect. So, and then I get the right date of birth and put the right date of birth there. So that's what we call data cleaning. And in data cleaning, you're looking for errors, inconsistencies. You're just looking for duplicates. Maybe I put Francesca's name twice. Maybe I put Joe's name twice. And then we take this data and we transform the data. And the reason we do this is to make the data suitable for analysis. So at this level, when we're transforming the data, and then we take this data and then we model the data. So in the statistical world, we call that modeling the data. And what do we mean by modeling the data? We're trying to identify patterns. So back to the first grade example, we take the average age and we realize, oh my, all first graders tend to be on average 6 years old. But then the youngest child here is 5 years old. The oldest kid in this classroom is 7 years old. So we call that descriptive statistics. And what that does for us, it gives us just a quick understanding of the classroom. So of course, in the classroom setting, it's quite easy to figure out your average sixth grader is 6 years old. But then what if it's a corporate challenge event and you're trying to find out how many people ran the race? So you can apply the same statistics in that. So then I can conclusively say, guess what? Your average sixth grader in this school is 6 years old, or your average sixth grader in this school is 7 years old. Your average sixth grader in this classroom loves pizza. So when we have a birthday party, guess what our favorite food we're going to order? It's going to be pizza because nobody likes cucumbers, right? So that in a nutshell is what data analytics is. It's just the science of taking the raw data, identifying trends, and then making conclusions. And the conclusion in this case will be for the birthday party, we're all getting pizza. So that's what data science is. And when data modeling, you can also take the data and take it to a statistical level where you start applying more complicated statistical analysis, and that's what we do in the hospital system. So we'll apply regression analysis, and at its most basic form, it's finding out how many patients did not make their PCP appointment or their provider appointment.
Right, meaning their primary care.
Yes, appointment in regard to where they live. So what we're trying to identify here is to see, did you not make your provider appointment because you live too far from the clinics? So, and that's where now statistical analysis starts getting more fun, more complicated, and we use that to make scientific and statistical conclusions, and also to some level.
Hold on a sec. So how would you then? Is there a survey if someone is unable to make their appointment? Let's say you found out persons living in zip code 14208, for instance, were unable to make their appointment. How did you get that information to begin to analyze it? Where did that piece of information, were phone calls made to see if they couldn't make it, or was it just looking at the charts to see that people didn't make their appointments?
So the first one will be looking at the chart. So the data that comes in through the chart when you call your doctor and you give them your name and your zip code and your address. And then we realize that maybe a group of patients in zip code 14208 have been missing their appointments because we can see a trend around that. Then at this point, we can do an analysis and find out how far are the clinics or how far is the doctor's office from this particular zip code. Maybe in that particular zip code, the doctor's office may be 10 miles away, the closest doctor's office may be 10 miles away. Maybe the bus in that particular zip code, so that's another good thing you can add to data analytics. Maybe the bus in that zip code only runs 3 times a day at 8 in the morning, 12 o'clock, and 5 in the evening. And my doctor's appointment was at 10 o'clock, right? So those are the decisions that we use data for. But then we are using the medical records when you called in to book your appointment, and that's what shows us that you didn't come for your appointment. So it lists you as a no-show. And then, yes, Francesca, we do follow up with a phone call in most cases to find out why did you not make the appointment.
Mm-hmm. Yeah, so I just wanted, you just had to break that part down because I just wanted to make sure our listeners then they connected the dots, so if you can't make your appointment, I just want there is someone looking at that information to find out why, to then help let's say help the community in that one zip code to figure out why, and to make sure you make your doctor's appointment and not just to gloss it over and ignore it. So sorry, go. I'm sorry, I apologize for interrupting, but go ahead. I just wanted to make sure that our listeners understood. And then how would it make it, how the analytics would then make a difference if people are missing their appointments based on looking at the data? They don't look at names. I just want to make sure our listeners understand they do not look at names, correct?
Nope, we just look at the data high level. So healthcare data is extremely sensitive, as you know. So in most cases, we look at data very high level, very de-identified, just very high level data. So we are not looking at anyone's names.
And then from there, and then what would happen if you realized that people were missing their appointments?
So if we realize, back to the zip code 14208, that people are missing their appointments, so I am trained as a statistician, so I take that data with me. And the first thing I'll ask myself, Francesca, is let me see what the bus route is. So this is public data, right? And census data does an excellent job in just helping people understand the demographics in each and every zip code. And zip code is high level, and then it's broken down to a block level and a tract level. So you can get really granular in the data. And the first thing I'll ask myself is, let me see what the demographic of this particular place is in terms of public transport. Why are people missing their appointments in this particular place? So I'll bring in public data like census data and layer that on top of my no-show list. And see, probably back to the example of the bus system, maybe the bus routes are just don't align. So that's a good place for a public official where we can go, we have data, we can conclusively reach out to the group that runs the bus systems and see, as a community, what can we do to have more buses run out here? And maybe the community that runs the bus system can tell us not a lot of people commute at that time of day. So that's why we don't have buses at that time. So we're having communication with data in front of us that's helping us make very informed decisions. So that's what data analytics is at its grand scheme. It helps us make highly informed decisions, both at a community level, clinical level, just everywhere, even just about our own personal lives. I mean, when you take your Fitbit, for instance, for people who wear Fitbits, it tells you you've walked 10,000 steps today, or you've only walked 2,000 steps today. So it's helping you make informed decisions every single day. And that's what makes it so fun, because you apply it to your own personal life too. So you leave the classroom, you apply to the community, and you apply to your own personal life. Yes. So
yeah, and I have to say that, having taken a few statistics courses, when you look at statistics, you really have to you have to put it in a fun story, in a story that makes sense. And these numbers really do make sense. I just want our listeners to know that the numbers make sense, because it could mean that a medical office needs to leave have extended hours. And we see that around the community. Or it might mean an opportunity for a new office. Is that the kind of I mean, what are some of the stories? Because I know we're talking about numbers, but numbers tell stories, right?
Yes, and they tell amazing, amazing stories. And to your point, where you say, like, let's say a certain clinic is only opened between 8 and 4 p.m., but then everyone who keeps calling is asking for 5 p.m. appointment, and they're told the 5 p.m. oh, we're closed, right? And if this data is being captured somewhere, this is a chance that the clinic can use to shift their office hours, right? So maybe have a lunch hour break from 12 to 1, because not a lot of people come at that time. Or maybe start at 10 o'clock, open the clinic at 10 and run the clinic all the way to 7 p.m. Because this is what data does. It makes us make very informed conclusions, very informed decisions. So when I come and talk to someone, I'm looking at the data in front of me and I'm telling them most patients want to see a doctor after hours, after 5 p.m. It's the only time they can come in. So we can shift our staffing, we can shift our schedules to accommodate patients who want to come at that time. So yes. So I mean, and we use data to tell amazing stories. If you want to open a grocery store, probably you've heard a lot about social determinants of health. And social determinants of health are mostly transportation, lack of access to fresh food, just security in the neighborhood. So let's say you're trying to decide, let's say a certain demographic or a certain county is struggling with one of the chronic illnesses, which includes diabetes. In this case, we'll use that as an example. And we're trying to understand data around this particular community and trying to see why are people struggling with diabetes in this community. If we look at probably the number of grocery stores and we find there aren't too many grocery stores that carry fresh food in this community, then we make an informed decision using data to tell us that we probably need access to more fresh food grocery stores in this community. And where will the grocery store be situated? Maybe it has to be within an average 2 mile radius of every single home than having it in the corner that is so far. And so that's what data does for us, Francesca. It helps us just make amazing, amazing decisions. And it does that on the hospital level too, when you think of readmissions, right? So that's big one of the big things that healthcare providers really worry about. How many people come to hospital, get discharged, and then get readmitted again? So what data does for us in these instances, which is quite amazing, and back to the basic example that I gave you, we look at high level, the percent of people that were readmitted. Then we start drawing conclusions and we see, does this high level, the identified data, percent of people that were readmitted, did they have a certain illness? We're identifying for trends. Maybe did they have diabetes? Did they have heart failure? So we start stratifying, taking that particular demographic and narrowing it down and making the providers aware of what the data is showing us, that most people who come to hospital and are diabetic and admitted are likely to be readmitted. So in their discharge protocol, then they're given much more information than if we didn't know that. So that's what data does. It helps us make decisions and make informed decisions.
Yes, and I tell you, and with diabetes, that's a major illness, and with so many food deserts and all these different stores closing, that is definitely a problem. And what was I going to say? How about, so we talk about data, and I just want to say data can even be used within the hospital setting internally. You just had made me think about our environmental department. So data would also determine what time some of our environmental staff would be needed, even in cleaning. Is that am I catching on to what data
Yes.
and kind of stories it could tell?
Yes, it helps you know. It helps you know. You can take maybe what is the highest time when people are likely to be readmitted. I mean, to be admitted, right? Or when are people likely to come to the ER? Maybe after, I don't know, who knows, after Christmas, because people have had so much fun, they've had so much to eat and drink, and who knows what's going on. And most people are rushed to the ER at that time, right? So we can use data to know that's when we need to staff for not only the clinicians, but also for people who help clean the hospital, who help clean our hospitals. Because behind their scenes, there's so many people who support the hospital, right? We have the people who help with cleaning. We have the people who help with diet in the hospital, right? We have the volunteers who are in the hospital. So we can use this data to know when to staff too.
Now, has data always been used at this level in hospitals? You know, it's funny. I didn't think I really understood, but now that you're explaining this, I could go on and on, but has, you know, with different examples of how data can be used looking at analyzing information outside of the hospital, such as, community, persons not making their medical appointments to internally, where, when to staff for example, cleaning. But has data always been utilized within the hospital environment, or is this something new?
So it's not entirely new. I think what makes it stand out is just how much it has evolved over the years. Because number one, we have to think about, just the introduction of computers, right? I mean, just think about how inexpensive it is right now to own a computer, and processing power has gotten much, much cheaper. So the introduction of computers paved the way for electronics health records. And what electronics health records are is pretty much, in the past, your records were stored in paper form, but now your records are electronically stored. So we're able to collect more data about a person than when the data was written down in a piece of paper where you just put your name and you put your address and your zip code. But now we can put that data in an electronic format, and when you move, we're able to easily update your address in our system. So we're able to tell you've moved to a different zip code. And by the way, the zip code you've moved to has more grocery stores or has fewer grocery stores, or the zip code you've moved to has access to more public transport or doesn't have access to more public transport. So I think data is just being used more and more because of just the evolution around computers, which has paved way for electronic medical records. As I stated, it's paved the way for statistical software. So we're able to analyze more and take in more data.
And the data is as good as the individuals who are providing the data. And you say grocery stores, which is always a sensitive issue, because I know they're closing some of in the community, some of the Dollar General, Family Dollar stores that did sell fresh fruits. I mean, I didn't sell, not always fresh, but they had frozen. So I don't know, in terms of looking at data, just to put that in some more, store closings that are taken or have taken place in the community, that being that of real time. Something else that I always like to tie into the radio program, our career. So if someone is interested and they are like, oh my God, this is what I want to do, this is what I want to be, this is what I'm striving for to be in life, what department does the work that you do with data analytics fall under?
So our department falls under IT, and under the IT department, which is an amazing department. It's just, all data flows through IT department. And when you go out to Kaleida.org, KaleidaHealthcare.org, and you're trying to look for how can I get to work for that team? If you go under job searches, they do a really amazing job to tell you to put in the title, the category, just put the keyword analytics. And that's what starts paving the way analytics. It starts opening the door for you to see what opportunities are out there.
Mm-hmm. Yeah. I mean, I think that's just so important to make sure our listeners understand. And again, we hire at all ages. I'm sorry, 18 and up. Not all ages. You have to be at least 18 years of age to work at Kaleida. Tell us something that we haven't covered that you would like to expand, or something we haven't touched on in data analytics. We have a good 4 minutes left.
With a good format. I think one thing I always tell people, I think one of the most overlooked majors in college is mathematics. So if you pursue that as a college degree, which is an exciting career because there's pure math and there's applied math, and applied math is just more, it's more applied. It's exactly what it means. So pure math is just pure math, and applied math is math that you get to apply. So if you major in that in college, it really opens the door for you to go into computer science, which AI, artificial intelligence, is actually based off, or you can go into math, which when you're a math major, you can also go into computer science, you can go into artificial intelligence, you can teach, which is the best part about life. You can teach and you can do statistical analysis. So that's one part that we've not covered.
Well, you know what, Caroline, you're gonna have to come back because I didn't have any questions on there about artificial intelligence. And can you just say what is? I know what the is the I know what artificial intelligence is, but you're the guest, so you have a few minutes to talk about artificial intelligence. What is artificial intelligence, and how does it impact the area of data analytics?
So what AI is doing, so artificial intelligence is this algorithm. So it's sophisticated computer algorithms that in the most part operate real time, like chat GPT, right? And what they're doing is they are transforming the healthcare and every landscape, actually. They're transforming landscapes in data collection. They're helping us make very streamlined decisions effectively. But like anything else, it has its biases and its challenges. But it's artificial intelligence is just the way the world is moving.
Oh, all right. No, thank you. And so, yeah, that's just a whole other area. Matter of fact, there's a
Yes.
conference coming up with artificial intelligence. I mean, you can write letters with artificial intelligence and sound like a genius, but with numbers and mathematics, and I know Carolyn talked about being, in college and math. But if you have a child or grandchild that you see is excelling in math, what would you recommend if for that listener with a child, grandchild, niece or nephew who is how would you then keep that interest? So, we're going into the summer months, and what would you recommend? You're a parent, so I know you have some ideas. You have
Yes.
a minute. Yep. Yep.
Yes, so back to artificial intelligence, where so back to artificial intelligence, where just real quick on that, I should have been a little bit clear on that. I just realized as a part of it I didn't answer. It's pretty much it's artificial intelligence is taking a computer system that you're trying to make it emulate or perform close enough to just human intelligence, but we'll always need the human touch in everything, right? But then as a parent, I always encourage the kids to always do math every single day. It's like anything else. If you don't use it, you lose it, right? And you just have to spend 5 minutes and do three problems, meaning if you're in first grade, just have the kid do 5 problems a day. And this can be 1 plus 1, 5 plus 5. And it's more so about the discipline and the consistency and not the how hard or easy it is. Because that's what life boils down to, discipline and
Right.
consistency. And once you're in seventh grade and eighth grade and you start doing geometry, then you're maintaining the discipline and the consistency. And what happens over time is that it starts coming to you just a little bit more quicker, just a little bit more quicker, because you're honing in on the foundations. And what makes math so beautiful and so unique is that you build onto it. So it's a subject that you build onto. So you always apply it gradually, gradually. And by the time you get to high school, it's a summation of all the way from first grade, but it never feels that way. It's an entire summation all the way from first grade to high school.
And Caroline, on that note, and that takes us into college. On that note, I'm going to say thank you because we're out of time, but we could go on and on. So,
I know.
so our guest for today, Great Lakes Health from Kaleida Health, is Carolyn Bukenya, who is the Vice President of Data Strategy and Analytics. I know you've learned something today, and I know I certainly have. I want to thank you for listening to the first part of our show. And please just grab your coffee, put it in the microwave for a second because we're getting ready for the second part of our program, talking about maternal health. And thank you, Caroline, for being our guest this morning. Thank you.
Thanks for having me.
And now on to part two. And welcome back to the second half of the Great Lakes Health radio program with Kaleida Health. I'm your host, Francesca Messiah, Manager, Workforce Development. And I'm hoping that you enjoyed the first half of our show that talked about the Visiting Nursing Association with Lisa Greiser, the Senior Vice President of Long-Term Care and the Visiting Nursing Association. But now we're going from Visiting Nursing Association, and our second guest is a nurse. However, today's topic, we will be talking about maternal mortality. I'm going to say that again, maternal mortality, very important topic. And our guest today, our expert, not only is she an expert in this area, she's been asked to speak on panels throughout New York State, and I'm sure across the country. And our guest for today is Luann Brown. Good morning, Luann. How are you?
Good morning, Francesca. Good. How are you?
Great. And Luann is a registered nurse and also the CEO, Chief Executive Officer of Buffalo Prenatal and Perinatal Network, which has been in Buffalo for 40 years, Luann?
Yeah,
How
since
many years?
1987.
1987. I know it's been a long time. And, you know, Luann, we are just going to jump right into the interview because the topic of maternal mortality, I don't want our listeners to miss one bit of information on it. But can we just start off with, could you just share, for those who don't know, what is the history of Buffalo prenatal and perinatal, and what do you attribute to the success of an organization that's been in Western New York since, would you say 1987?
Mm-hmm. Mm-hmm.
Okay.
Yes. So we Buffalo Prenatal Perinatal Network actually was originated by Governor Mario Cuomo, for some of you young people that remember him. And he was concerned about the high rates of low birth weight and infant mortality rates in New York State. So he created, I think it was 16 at the time. I think we're down to 14 networks. So we have peers across the state. So that's our primary focus, is reduction of low birth weight and infant mortality. I would say the success of our program is due to our staff. We are a home visiting program, and we have two separate programs. We have a Healthy Families New York program, and we have a community health worker program. They both focus on pregnant and parenting women, primarily on the east and west side of Buffalo, because unfortunately, that's the areas where many Black and Hispanic moms live, and they have the highest rates. Healthy Families does go a little further out into the outer ring suburbs. They do Cheektowaga, Lackawanna, South Buffalo, a little bit of Tonawanda, a little bit of Hamburg. So because we're home visiting, we spend a lot of time with the clients and we see them in their homes, which is a privilege for us, because it's hard for people to let you in their homes, and we really have to gain their trust. But my staff are from the communities we serve. So the majority of my staff are Black and Hispanic. Probably 30% of my staff speak Spanish. So they're considered trusted advisors. And I think when they go in there and they work with the moms, depending on which program they're in, anywhere from 2 to 5 years, and, do a lot of education on parenting and child development, but also and health issues. We make sure they go to their prenatal visits, their postpartum visits, the well child visits, that they're getting immunizations, all those important things. And I think that, but we also work with the social determinants of health that most of our clients face, whether it's housing, which, Francesca, I don't have to tell you what a nightmare housing is in Buffalo. And I won't go on my housing rant, but again, housing is an issue for, we do not have enough housing for families. And my staff has become much more involved in this process. We have, the homeless moms. We have moms that we have to get out quickly because of domestic violence. And the majority of our moms are just in substandard housing. And that might be lead, that might be mold, that might be rodents. And no one.
It might be all of the above.
And it might be all of the above. And really, no one, we're talking pregnant moms with kids. So, again, if anyone's out there listening that wants to help us with that, I'd be really happy. But housing is a huge issue. But we also deal with things like, food insecurity. So it's pantries, whether they have baby basics, do they have a crib for the baby? Do they have clothes for the baby? So that's kind of the role that we play. And then we also have a newest program, which is our fatherhood program, because I felt when I started it a couple years ago, we were kind of missing the boat with dads. Dads are very important to the whole structure of the family. And unfortunately, the United States has the largest number of fatherless families in the whole world. And research shows when there's no dad in the home, there's outcomes like, drug use, criminal justice involvement, dropping out of school. So dads are important. They do play an important role, and we're trying to, you know, ensure them and raise them to that level because they are important.
Yes, they are very important. And I just want to say that I yesterday when just doing a little bit of research, you're when you pull up the page, Buffalo Prenatal and Perinatal Network, and everything what you're saying right here, it says linking women. We've talked about women, linking women, fathers, and families to a better way of life. And that's exactly what you have just summed up. So I just want to say thank you for your leadership and all you've done. I work closely with you on other committees and with the Near East and West Side Task Force. And I just want to say thank you. Before we talk about the topic of maternal mortality, based on what you just finished, the overview of Buffalo Pre and Perinatal, if listeners are interested in the services, whom should they contact?
Yeah, they can call us. Our number is 716-884-6711. And if you go to our website, which is www.bppn.org, you'll see all our programs, providers or social workers or nurses. You can make a referral. Each program is listed. You can self-refer. We get a lot of self-referrals or word of mouth referrals. So everything is on that page. And that's the easiest way to get a hold of us.
Thank you. So I'm with our topic of today, maternal mortality. What is maternal mortality?
Well, maternal mortality defines, as a mom who loses her life, and it depends. Sometimes they will define it. It's usually during the pregnancy period or up to 42 days after. New York State, part of, now we're going into the Cuomo family, but Andrew Cuomo a couple of years ago did a whole women's agenda. And one of his points was he developed this maternal mortality review board. So they put their first report out a couple years ago, and it was covering 2018, but they just recently sent out the newest report, which covers 18 through 20. And it's not great. They're showing that in New York State, for every 1,000 deliveries, we have 19.3 deaths. The Healthy Families Goal, which is out of the CDC for 2030, is supposed to be 15.7. So we're already over the mark. What's more disturbing is that in those numbers, and this is nationally as well, is that Black women are 4 to 5 times more likely to suffer maternal mortality. In the period from 18 to 20, there were in New York State, there were 386 maternal deaths. The majority of them were the moms who were over 30 with less of a high school education and were on Medicaid. The three top reasons for the maternal mortality were hemorrhage, embolism, and very concerning, which kind of popped up in this last report, mental health conditions, which can be substance abuse like overdoses, but also suicide. There's been a spike in those numbers, which is very concerning. And half of the deaths occurred 42 days after the birth of the baby. So that speaks to the importance of that after, and sometimes the moms, they have the baby and it's very difficult Not for us, but for a lot of providers to get those moms to come back in for that, that 6 week postpartum visit. They feel like they're fine or else they're exhausted. They just don't go in. And we are like over 95% in getting our moms to their postpartum visits. Important not only for the physical, but the mental check-in. So I think that's just stresses the point, that all those issues. I mean, we've started last year through some funding from the Cummings Foundation. We started a self-monitoring blood pressure program where we give our moms in the last trimester, or if they're 8 weeks postpartum, we give them a blood pressure cuff. And it's very, very simple, like education. We give them an educational sheet. We go through. It's one of the electronic ones. It's very easy to use. We give log sheet to record it. We tell them what's normal. We also give them health tips, whether it's, exercise or diet. And we do that because those are the critical periods, and you can't just forget about the mom after she delivers. And the data just speaks to that 40, the majority of those are occurring after. And the other disturbing part was that 73% of these deaths, this mortality board determined were preventable. And in almost half of them, the board determined that there was some type of discrimination in the case. So that speaks to everything, that, we try to work with our clients on. And, implicit bias, Francesca, you and I have talked about this. I mean, and I'm a nurse, and nobody goes into the healthcare field to be biased against their clients. But the reality is, if you have not had that lived experience, I mean, I certainly have not had that experience. So, which is why I listen to my staff and my clients. You don't do it, but if you're not used to that culture. So, New York State also put in a lot of training that like the medical schools have to do. I'm really interested in doing some implicit bias training. I'm actually working with an actress from San Francisco that has done like vignettes with music, but we really are looking at doing vignettes on different implicit bias scenarios and showing those to not only medical students and OB residents, but nursing students, social workers, anybody that interacts with the mom, because they all can have an impact. So that's important. I mean, the hospitals have really, when you hear about the things like the hemorrhage being the number one cause. So the hospitals have put in place with New York State like hemorrhage drills, and they have hemorrhage carts where they almost do like a fire drill. It's prepared so that if a mom starts to hemorrhage, they got everything right there. Everyone knows what to do. And I think that's had an impact, and it will have an impact. I think the mental health, we just did it for our Black Maternal Health Week this year. We focused on mental health. And some of the statistics were like so scary that they're saying that 1 in 4 women are listing at OD as their leading cause of death. That Black women, again, 40% of Black women experience mental health issues more than white women, than all women. They said that 14% of women have a new episode during pregnancy. Some of them, 14% deliver 3 months after birth. Again, that important postpartum period. And then the other issue is only 20% of women are screened, and half of women don't receive support. So, depression screening is becoming more common, and with physicians, we screen in our programs, both the programs, we screen at different times during the pregnancy. And because of that, like several years ago, we noticed first in our community health worker program that we were scoring, getting high scores, and our moms are very nervous about going to a counseling service because they're afraid someone's going to take the baby away. So they will not, and there's still the stigma with mental health.
Yeah, and yes, and can I just interject real quick? And it's true. I mean, growing up, sometimes you would hear you don't want to go. So it is something that has, I don't know if I should say culturally, but it really is. I've had the conversation many times. You were told don't go because it'll
Don't
stay
go.
on your record. It'll stay on your
Right.
record forever.
Right. Well, and when we did the mental health conference, we had two of our clients speak, and one of the clients spoke to that. She said, my family, that was not the message we got growing up. It was kind
Never.
of like suck it up and just deal with it. But I mean, so we ended up starting, we just have kicked off our second one in healthy families. But so we run an empowerment group, that's what we call it, for our moms with depression, like once a month. And we have a mental health counselor because my staff are not clinical people. So we have a mental health
Right.
counselor come in, because and try to deal with them, teach them strategies. But the goal really is to get them comfortable with a counselor so they'll do individual counseling, which is really what our goal is, because that's what they need. But I mean, that's important. The screening is important. They said that the other thing that was concerning, they said that a new mom's odds for suicide are 7 times after the diagnosis of perinatal depression. And it lingers. They said like 5 to 18 years after they get diagnosed, a mom who had perinatal depression, is her suicide rate is double a woman with no depression. So, and there's a lot of things we need to do with that. Obviously, getting rid of the stigma, the implicit bias, we need to, and we also need to have providers that look like our clients. I mean, that's the one thing my clients always ask for. They want to go to somebody that looks like them. That's just the way with everything.
True,
Um,
but and then you hope that when they look like them, they are just as
right.
empathetic,
That's right.
Right.
That's right. And I think that, that also means, and, the support groups are important. But, the other thing, it's these underlying social determinants of health, that also stress moms. So again, when we start with a mom, we can't all of a sudden start talking about their health goals, because we might need to deal with the fact that they don't know where they're sleeping that night. You can't,
And
prioritize things.
you're right. And anyone who knows me knows that I call it the social determinants of life.
Right,
It's not just the social determinants of health, because like you said, health could be number three.
right.
If you're a pregnant mom and you're being evicted and you have a family,
Hmm.
you then have to many times put your clothes in plastic bags because you don't have a suitcase. I know
Right,
people talk about plastic bags, but plastic bags in many families become a lifesaver
right,
because the cloth bags cost money. I mean, that's a
right,
whole area. But you know, in terms of the what you provide and talking about maternal mortality,
hmm
who so does Buffalo prenatal and perinatal work with certain zip codes, or are there
yes,
zip
yes.
codes, or I should say, what are the zip codes? I would just want for our listeners to know, like the zip codes that you've always worked in. It's not new.
No, it's not new. It's mostly east and west side. I can actually rattle them off to you. Give me 1 second. I got them right here. But it's mostly east and west, and we do a needs assessment every year because things change. We'll find, with gentrification sometimes, we'll go into a zip code that we used to be forever, and the population has totally changed. So we have to kind of adjust to that. And we look at the newest stats. So I'll just rattle them off here. So it's 1 4. So it's 201, 202, 203, 204, 206, 207, 208, 209, 210, 211, 212, 213, 214, 215, 216, 218, and 225. And then Healthy Families does also go into, because I mentioned they do 150, 219, 220, and 222. So those are pretty consistent what we've done, the areas that we've gone into. Um, yeah, but I guess, it really is, with the mental health especially, those social determinants of health are just our life, as you say it, which is true. It's just you have to get them stable because they can't concentrate on anything until they know they've got security in a safe environment and their kids are safe. Um, so I think that's been a big focus um, of the state. And that's kind of like, and nationally, President Biden just came out with a whole new, I haven't read it yet, but he just came out with a whole new mental health report with solutions and um and those kind of things, and I think, and I'm going to be, selfish and say here that, they should be investing in organizations like ours because, and I worked at Children's for 30 years. I worked in the OB areas, and I know the caregivers, how busy they are, but they're not, when we're, they're seeing that client for a snapshot, but when they go home, we're with them all the time. So we really have our eyes on them. And that's why, we make sure, we're calling and making sure they're going to their prenatal appointments. Sometimes we're transporting them or we're providing transportation. I mean, the other program we have, which was done in concert with United Way and the NFTA, federal grant, is Go Buffalo Mom. So we have a transportation navigator that is in the prenatal clinics at both Kaleida and the Catholic Health, as well as we just kicked off something with Neighborhood Health Center. Because transportation is like one of the biggest barriers. Well, they did the focus group with our clients like 10 years ago. That's why they wrote the grant. So this person basically, connects with the mom, and it's either she gets them bus passes, or if they're eligible for Medicaid cabs, she'll arrange the cabs for their whole appointment. And it's, the recent report that we just ran, that our Duval College actually did the evaluation on the program. And, again, we can't take credit for all of it, but except during COVID, because nothing was normal during COVID, the moms that were in Go Buffalo Mom had less kids in the NICU. And if their kids were in the NICU, they were in there shorter periods of time. So it does make an impact. I mean, they have to get to their prenatal appointments, because if there's going to be an issue that arises, they're gonna that's when you pick up on it. If they're not going to their appointments, it's going to be a problem.
Mm-hmm. So Buffalo Pre and Perinatal keeps up with the family. How do they do that?
All right, yeah. So no, we're in the home. I mean, during COVID, I mean, we were maybe virtual for a couple months. In August, we went right back out in the home because, a lot of times we're the only support these moms have. And we are still delivering diapers and food and all those kind of things. But, we usually early, like Healthy Families has got a very structured, how often they see the mom when they're pregnant. And we obviously like to get the moms when they're pregnant, because so we can have a longer impact with them. But when the baby's born, they're in there every week for 6 months. With community health worker, they tend to get, they're looking for the mom that's not connected to the system. So they're the most, probably like even more vulnerable. So they could spend like 6 or 7 visits the first 2 weeks, because they're taking them to DSS to get their benefits, and they do street outreach, and they get a lot of referrals. So when the weather's nice in Buffalo, they're in the neighborhoods knocking on doors. They go to the bus station, they go to the train station, and we find moms under bridges. We found a mom living in her car with her toddler like 2 years ago. So it's this constant interaction where they've developed a relationship, and they have to build that trust. You know how they've been burned by the system, our clients sometimes. So they're very mistrustful. So we have to really prove ourselves to them. And then of course they never want to leave us. They're like, we want to stay. We don't want to graduate. But so it's the home. I think the home visiting is key because, and I laugh, and I don't mean to be cynical, but when people say, well, we call people on the phone. Well, do you think they're telling you the truth? I mean, sometimes they're embarrassed. They don't want to tell you what's happening. And I think when we walk into the homes, we see the mom laying 8 months pregnant, laying on the floor because she doesn't have a bed. We buy a lot of mattresses and box springs. We open the refrigerator and there's no, what I'm saying? It's a very different experience. And you see what's impacting them when you're in the home.
And I just have to say, Luann, that my very first job out of college was housing. And it's when I worked in housing, I was housing specialist, Maston District, Cold Springs, and there's one other area, but all in the between Dodge and Main Street. The whole point is that when I would see flies in sub-freezing weather flying around in homes, or when I saw or leaky roofs,
right,
and there was a direct relationship to healthcare, and that's when I knew in time I was going to move into healthcare.
Yep.
Because you just see and my background is sociology, but that was a whole the whole relationship and made me realize that your health and your housing went hand in hand. So yes, going into the homes versus a text or whatever. There's so many ways of communicating. And I know we don't have much time left, which means we're going to definitely do another show.
Okay, we will. Great.
Let's probably. I'm just going to put September.
Okay.
Because it's back to school. Because I want to talk about again, maternal mortality, huge. We will be back in a few months to talk more about that. Upcoming fundraisers, because funding is what keeps your organization going. And I also want to say you also do hire staff who have been moms. So I just want to let people know that Luann walks the walk, talks the talk, walks the walk. But I want to talk about your fundraisers before we have to go. You have two big ones.
Yeah, so we have our big fundraiser is Great Baby Beginnings. It's July 24th at the Foundry. It's a very nice event. It's like 5 to 8, and we do, there's food and drinks, but we do give some awards out. Some of our clients speak, which is probably the most impactful part of the whole thing. We are also, if anyone's in a cocktail mood, we are doing a fundraiser at the XYZ, the 500 Pearl bar, actually both bars. It's an easy lift for us. Anybody who's in there will get $1 for every drink of anyone who drinks. So there's that going on. But the Great Baby Beginnings is the big event. That information's on our website.
And where is that? Because I'm putting it on my calendar right now. Where is that?
Which one? The Great Baby
Buffalo.
Beginnings?
Yes.
Yeah, it's at the Foundry. Same place as last year. Yeah, yes, at the Foundry on Elmwood. So yeah, because we're 95% grant funded, and our grants do not always fund things like beds. So we rely on grants and and smaller grants, fundraising, so we can buy beds or refrigerators or stoves for our clients.
Mm-hmm. And then let's say, and where's the second one? At the 500 Pearl?
The second one, the second one is it's at 500 Pearl. So if you're at the the rooftop bar or on the bar in the hotel, anybody who's there, any
and what's
drink.
The date?
It's June 28th.
Yep, I have that on my calendar already.
Okay, because it's a Friday. It'll be fun. That's right.
It'll be fun. Yes. And Luann, I just want to thank you for being our guest. We have barely scratched the surface in maternal mortality and your expertise in that area. But I'm going to bring you back in September. I'm going to just put a little note to myself. I'm going to do the second, because we're the second and fourth Friday, second and fourth Saturday. So I just want to thank Luann Brown, CEO of Buffalo Pre and Perinatal Network, for being our guest this morning, the second half of the Great Lakes Health Radio program. Thank you, Luann. And next week, you'll hear from Cindy Bass, my esteemed colleague from ECMC. And I also want to let our listeners know, please look for our health pavilion, the Juneteenth share that Kaleida Health and ECMC share at Juneteenth. Our pavilion is normally, it faces a parade route, and we would be like the last large pavilion before the grandstand, which is a way of looking at it. And I just want to thank our listeners again for listening to the Great Lakes Health Radio program here on Power 96.5 FM, WUFO 1080 AM. And also, don't forget, if you're in need of a job and want to begin a new career, please check out the Kaleida Health website. My name is Francesca Messiah, Manager Workforce Development from Kaleida Health. And I want to say have a very safe week. Bye-bye.